My center colleagues and I have been involved in research and collaborations with Baltimore city officials in public health, law enforcement, and the mayor's office for about 2 decades. But I've never been so excited for our city and for opportunities for collaboration than now. That's due to the recent election of Mayor Brandon Scott and his appointment of Shantay Jackson as head of the mayor's office for neighborhood safety and engagement. Welcome and thank you both for participating in our symposium. Mayor Scott, I want to direct the first question towards you. You've been a long time believer in public health approaches to gun violence prevention. Can you share with us how you plan to address gun violence and any thoughts
Yes.
you have about how the center has influenced your thinking about the issue?
Oh, wow. Thank you. Thank you, Dr. Webster, and thank you for having me. I want to first say happy anniversary, 25th anniversary to the center, and thank you for all the work that you have done to utilize public health and policy to make our streets more safe. I think for me, this is about the experience, the trauma that I've experienced, and the violence and how it's all connected. When I and the people around me, when I was growing up, experienced violence, it had detrimental effects on both our emotional and physical health. And as you know, in order to address violence, we have to get to the root of the issue, and we have to treat violence as a public health issue. We are going to address gun violence in Baltimore in an entirely new way. I'm looking to address violence with an all hands on deck approach. That's why we started the Mayor's Office of Neighborhood Safety and Engagement with Director Jackson leading that. You're the center's research shows that a vast majority of the guns in Baltimore is coming from a small number of individuals who we also know that is coming from outside the city. But for me, it's about making sure that we are getting out of the mindset that we're going to solely rely on our police department to reduce violence in our city. Yes, we know there'll be a role for that. That's about, as you know, and learning, and I have learned one of the ways the center has helped me over the years is about targeted enforcement and approaches, focusing in on, as you and I have spent hours talking about, not every little minor crime or going back to the days of zero tolerance, but focusing in on those small groups of individuals who are committing the overwhelming majority of the violence in the city. We're going to be doing that under Director Jackson's leadership in partnership with our police commissioner through fully implementing a group violence reduction strategy. We also have to understand that we're going to target individuals in a different way. We will target gun trafficking, but it's also about the other things that we can do. You and I have walked and talked a lot about our safe streets and our violence interrupters in the city of Baltimore. We know the success and the early success we've had for our program, but we now also know that we have to take that further. We have to go to Safe Streets 2.0 and make sure that those individuals are being able to not just interrupt violence, but connect folks to other opportunities. Every other city agency also has a role in this, and that will be part of Director Jackson's focus is we will make sure that DPW, housing, rec and parks, health, partner with our schools, partner with MOED to make sure that we are doing everything as a city government in its entirety to impact the environment in which violence has seemed to thrive in our city for far too long.
Well, I'm very excited about the opportunities ahead and your leadership in this. I want to turn now to Director Jackson, and I also just want to pause for a minute to connect and reflect upon Dante Barksdale's work and contribution, probably to all of our thinking about how we should be addressing violence, particularly as a public health problem. Director Jackson, you're now in a key leadership role in community safety and engagement. In a report from the Public Safety Committee that I served on, we noted a direct connection between the level and types of supports offered in programs that are reaching the highest risks for gun involvement, like Safe Streets. What are your top priorities for strengthening and expanding community violence prevention in Baltimore?
Thank you so much, Dr. Webster, for having me today. So I would say that in reading your report and also hearing directly from Baltimoreans, the mayor's approach is the approach that I'm looking to implement, which involves creating capacity for community-based organizations. And creating that capacity isn't just a matter of providing technical assistance associated with how to write a grant or how to engage with community members, but it's also about becoming an intermediary through which community-based organizations can apply for grant dollars so that they become co-producers with us, with BPD, with city agencies in creating the neighborhood safety that they believe that they need. In addition to that, the mayor also mentioned this a bit ago, making sure that we reevaluate what's worked well with regard to our Safe Streets implementation and taking the time to do some research around culturally, operationally, from an implementation perspective in partnership with you and others, what's working well and what should change. We have seen some hybridization of the cure violence approach across the country reap significant results and benefits in communities. And we're going to be looking to do that here, making sure that it is culturally relevant, contextually, geographically relevant for the city of Baltimore.
Well, that's great. I'm going to end here, I think, asking what I recognize as a big question, but I'd like to just sort of get some general thoughts. We know that, we need to focus on those at highest risk, but there's also the set of conditions that create that risk. You can think of this very specifically in terms of abandoned houses and issues like that. But connecting this actual to structural racism, what are your general thoughts about how this administration can start to address some of those issues as a way to make communities safer?
Yeah, thank you for that, Dr. Webster. And I think that, listen, we have to understand that the Baltimore City that we live in today in 2021 is directly connected to Baltimore City being the first place to have a racial redlining law passed. It was weaponized here in Baltimore and taken everywhere else. And the only way, Dr. Webster, that you're ever going to undo racism and inequity that was caused through policy is by changing the policy and changing the actions that come from those policies. We know that I actually sponsored and passed Baltimore's equity law, and now my administration, fate would have it, is going to be the one that has to implement it. And what we have to do is start to deal with all the things that you mentioned. One, the city has to start to invest its money in those neighborhoods, right? We have seen that the studies that show how our capital money is spent in the rich white neighborhoods and not the poor black neighborhoods that were redlined for many years, and the environmental things that come out of that lead to violence. When you start to invest in those neighborhoods, in the people there, you will see a long-term, this is how we can see the long-term impacts of reducing violence in Baltimore. This is not an either or approach. Yes, we have to focus on the immediate day-to-day, and we will do that continuously and do it in a better way. But we also have to make sure that we are spending our capital dollars, our operating dollars, to benefit people in those neighborhoods, having strategies to deal with vacant houses, making sure that we're dealing with folks who are re-entering into our community in a more improved way, making sure that we're providing educational opportunities for our young people and adults to be able to obtain career and job placement here in Baltimore that will provide for their families. That's how you're going to do that tough work of doing it. And that's not easy work, and that for sure isn't overnight work, but somebody has to be at the ground foundational building level, and that's where we are. We are trying to build a new house for Baltimore City, and we're at the foundation so that we can one day put the shiny thing on the top of the building.
Well, Mayor Scott and Director Jackson, my colleagues and I at the center are eager to collaborate with you and community partners to help you achieve these goals for reducing violence and advancing equity and justice. We thank you so much for your leadership and for your partnership with our center and, of course, participating in the symposium.